this wasn't about, it was just all management costs, not the costs of the market. So I don't know if they don't know or if they don't want to say, but I think it's shocking that they refuse to tell a health select committee. And that is one of the problems with Parliament, that actually the health select committee, but the select committees have no power. And they work very hard, they produce good reports, and then nothing happens to them on the whole. Now, the estimated cost of reorganisation, well, originally they said it was 1.7, now they said it's 1.4, and it's going to be recouped in 5 years. But the King's Fund, who are not known to be a left-wing organisation, an independent think tank, they said it would be up to 3 billion. And I think one of the amendments that could go in the bill is that no person who is employed by a consortium, if it gets to that, should be allowed to have redundancy pay. Because we saw all that in several of the other reorganisations, people being paid £100,000, £200,000, and 5 minutes later signing up for another NHS job, which is completely crap. Now, the Care Quality Commission, that was the organisation that didn't notice that Basildon and staffs were in trouble. And nobody ever seems to say, hold on a minute, have we got our regulatory system right? Is this the best way to do it? No, let's put more money in it and say that they're going to make it better. So I don't know that them becoming an effective regulator is actually going to happen. And also now they're supposed to be taking over if this thing about the registering the companies goes ahead, they're going to be doing that as well. And also they're looking at the health watches, which is the patient's voice, as it were. Now, we will give every patient the power to choose any health care provider that meets NHS standards within NHS prices. This includes independent, voluntary and digital sector providers. Well, as Graham said, at the beginning of the health service, that just happened. It was only Kenneth Clark's changes in the 1989 working for patients document that stopped that. Now, why has that white bit come up there? Now, almost everybody criticised these so-called reforms. Even right-wing think tanks like Civitas criticised them. The NHS Managers Organisation criticised them. The Nuffield Foundation criticised them. The King's Fund, the RCN, the BMA, almost everybody. Only positive response came from the private healthcare industry. And this comment from Kingsley and Manning on their website within 24 hours of the bill being published says, this white paper could amount to the denationalisation of healthcare services in England and is the most important redirection of the NHS in more than a generation, going further than any Secretary of State has gone before. And Nancy says it's not a revolution. Right, so what's going to be the effect? Well, this effect on managers. Of course, in NHS London are already rushing around, sucking up to GPs, reorganising themselves into little groups of PCTs, and I'm sure the top ones won't suffer at all. It's just the lower down managers that are going to be sacked. The consortia must use any winning card. Private companies will bid for services cheaply. Now, if Lansley really cared about this, he would not have said that they would change the tariff. I mean, I don't agree with this whole tariff business, but that there it is, and it was set for the whole of the country, with perhaps some modification of geographical differences. But New Labour set the way by saying, well, this is the maximum. So just suggesting that perhaps people could do it more cheaply. But now Lansley has said out loud, you can provide services, if you can provide services more cheaply, fine, that's all right. So price competition, if this is introduced, there is no doubt that quality will suffer and hospitals will fail, because if they can't do these operations and things because the private sector are doing them more cheaply, then their income will go down, and then they'll be not in balance, and then they'll be out. And then also the consortia will probably fail, because if they try and get the cheapest thing, but it's not necessarily close to them and things like that, patients are not going to be very pleased. But also, the consortia, if they do overspend, are going to find themselves being taken over by Monitor, and then the private companies will come in. And so the net result would be that the NHS becomes fragmented and reduced to a sort of basic backup. Education and training are hardly mentioned in this, and this has been one of the whole things about the private sector coming in. People lose opportunities for training. In surgery, for example, if all the easy cases go to a so-called independent sector treatment sector, ISTC, then it's much more difficult for young doctors to learn, and the only cases that are left are the more difficult ones. Now, the government's tactics have been very clever. They use this reassuring language, liberating. And it's interesting that Margaret, the person who determines the person, I've forgotten her surname. Anyhow, in the Lancet said the only liberation seems to be liberating 100 billion to the private sector. Now, the consultation, you know, you're drowned in consultations. They're all 80 pages long in this turgid DH language and the rest of it. But they said right at the beginning, this consultation is about the how, not the what. I would have said whether, but and the first rule in the government's own thing about consultation is that you must be able to make a significant difference. So if you're told that you can't even discuss what is going to be done, but only how it's going to be done, that fails that test. Unison did try and take them to court, but the judiciary seemed less willing to fight on this front than they are on some other areas. And in November, the Department of Health sent a directive to PCTs and SHAs to tell them that their people, if they took redundancy pay by the end of November, they would get a good fat amount. And they haven't even come before Parliament. And they've got their message across as if the changes have already happened, although no electoral mandate or debate in Parliament until the 31st of January. So we've really got a huge battle on our hands, because unlike forests, where people can see what will happen if they're privatised, the changes here are so complicated, and most people don't actually understand how the NHS is organised anyway. They just know that when they're sick, they go to their GP and then they're referred to hospital and they have whatever is necessary done, and it doesn't cost them anything except the cost of prescription charges. So this argument that it doesn't matter who provides the service, the Financial Times, again not a left-wing organisation, found that 75% of the population did not want private sector in the NHS. Private companies' primary duty is to their shareholders. Cooperation, not competition, is needed in healthcare. And this point about the EU competition law. When I was doing my MSc in public health, Julian Legrand taught me that healthcare is not a suitable topic, area for a market, for a variety of reasons I won't go into. Now, we estimate that the cost of the market is at least 10 billion a year. Alison Pollock thinks it might be as high as 18 billion a year. So, if we stopped having this market tomorrow, we could save the 20 billion that Nicholson says is necessary to fund the terrible problems of us ageing people who use up so much NHS resources, and the fact that inflation is higher for medical equipment and drugs. And we could do that, 10 billion a year, it would be done. But no one wants to talk about that, and that's very interesting to me. But I think what we really have got to do is to exploit the differences between the convents, because whilst the majority of Tories probably agree with this ideology, which Ben's explained so well, the Liberal Democrats are split between their sort of economic liberals and their social liberals. And and we've got to really get to that. The fight must continue because, as I said, we can make the efficiency savings. The problem with market is that it increases inequity and affects the elderly and other most vulnerable people. And underlying all of this is we've got a huge deficit. But why should ordinary people pay for the backers' excesses and failure of government regulation of financial markets? I mean, it's absolutely outrageous. And, you know, we're not on the streets like the Greeks said or the French, but maybe the time has come for us to think about doing that. Because far more money is not collected from corporations and rich people by tax evasion, not mentioning tax avoidance, than is ever lost from the welfare benefit sheets we hear about in our papers quite frequently. Now, Lansbury stated his aims: patient-centred approach, no decision about me without me. And that is taken from research that is all about the relationship between the doctor and the patient. And I think that doctors have become much better. And I think the GMC document, Tomorrow's Doctors in 1984, made a huge difference in the way that people related to patients, doctors related to patients. And their good medical practice has reinforced the importance of keeping patients informed and respecting their decisions to have or not have treatment. He says that clinicians are in charge, not managers. But they won't be. The GPs in these consortia are going to become like managers. It's going to be advised by managers. And it's just a con trick to keep the medical profession happy. And the BMA, sadly, I think, did not fight this head-on right at the beginning. And they went on along with what they called critical engagement. I made a slip on that, and I call it constructive engagement in our newspaper. And I think that's because that's the way it seemed to be. Of course, we want to reduce bureaucracy. And then he's got this other idea of improved outcomes measured by PROMs, not targets. Now, that PROMs are patient-reported outcome measures. And as far as I am aware, these are still really in a research stage. But they're quite complicated to administer. And to say that people's pay or what they get paid for doing the work will rest on these PROMs, I think is a real problem. And of course, some of these targets were perverse incentives. And I do think that the waiting lists fell, not because of the targets, but because of the money that went into the NHS, which had been underfunded for years. And even Wanders, who did this report on the NHS in 2002, before Northern Rock crashed, because he was the financial risk person for Northern Rock, which is an interesting little thing. Most people don't connect these things because they're different areas. But anyhow, this man who knew all about the NHS didn't seem to know all that much about Northern Rock. And he measured the amount that the NHS has been underfunded over the years in hundreds of billions of pounds. So all this could be achieved without this tax about people. And the problem is that the Congress have put out briefing materials for their MPs. I mean, there are lots of bills going through Parliament. What MP is going to read 367 pages of dense legal language. Of course they're going to depend on what they're told. And there are several glaring errors in this, and we're busy writing to Lib Dem MPs, trying to get them to see that they're being conned by the Conservatives. So we've got 86 votes. Now I know one of those is a Lib Dem who didn't approve of these things, but obviously didn't want to show his hand at this point because of the wits will be round there with their wits. And the committee stage starts tomorrow and ends on the 31st of March. And then you get a report stage and then it goes to the Lords. So probably the third reading will be before the summer recess. And that's where it will either get passed or not. And we've got a chance in this committee stage to make some amendments. And I think this is the first time, I may be wrong, but the public can comment at this committee stage, which I don't think we could do in the past, by emailing scrutiny at Parliament UK. And I think we should overwhelm the committee with our comments. Just all of us. It's quite simple, isn't it, to send an email. The only problem with that is that I think the poor civil servants were the ones who are dealing with that. And one of them said to me last week that they weren't being paid for any overtime because of the cuts. So what can we do? Let MPs know every constituency that another religious organisation, Chris Ham's word, is the last thing we as citizens or the NHS staff want. And rebut this coalition briefing. Point out that abolishing the market, blah, 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 would save at least 10 million a year. And then I'd like you to join or donate to Keep Our NHS Public so we can mobilise people via meetings, websites, Facebook and Twitter. Because, you know, it's all very well as an individual to sit there for hours tweeting away, but if you're an organisation, there's only so many hours in a day and it takes time and you have to employ people to do it. And then on the 26th of March, there's going to be a TUC march, which they're hoping is going to be really large, and I hope we can get a health contingent there, and that we can get lots of doctors and nurses. I mean, something like 670,000 nurses in this country. So even if we got a third of them, that would be a lot of people. And then, just to understand all of this, I never understood how could New Labour do all this until I read Colin Lee's book, Market-Driven Politics. And this bit where he talks about real markets being deeply political, because the state's omnipresent, the state and politics are always targets for businesses who want to enter the NHS. And right back in 1994, there was a piece in the Financial Times about these American healthcare organisations putting their eye on Europe. You convert services into commodities and the workforce into one orientated to profit and get government to underwrite the risk. And we've seen that very well with PFI, which I haven't talked about because there's so much to say there. Market competition transforms commodities. And when I heard a spokesperson for a PCT in East London talking about this is a good business opportunity for us, I thought, they've really done it. They've packed these things with these organisations with business-orientated people instead of health-orientated people. So the effect of this is inequality of provision, high costs, and corruption, which we don't think we have in our health system and our political system. But when you saw that Channel 4 programme with Patricia Hewitt talking to, I can't remember which company it was, and now she's on the Boots board earning more than the average median wage for 1 day a week. Makes you wonder. So I just put some further reading up because I know you're all enthusiastic students and will appreciate that. Thank you.